1 hour.
ahead.
Yes, yes.
1 hour.
And what is the time in this Singapore?
10
Dr.
o'clock
Victor?
at night. 10 o'clock at night.
10 o'clock.
Oh,
Oh my God.
sleeping
Yes.
time.
No, I'm okay. I think we
Oh,
had a long day, and it's a nice thing to share my experience as well, and to hear from you during this.
Yes.
Is it visible?
Yeah, it's visible.
Oh, thank you.
হ্যালো, হ্যাঁ আমি ওয়েবিনার শুরু করতেছি। 10টা বাজবে। আচ্ছা, চলে যাক, অসুবিধা নেই।
Good evening, Namrata ma'am.
Hello, Dr. Devakant,
Good evening.
the Indian young hero. How are you?
Fine, sir. Fine. Thank you for inviting me. Yeah.
Hi, Devakant. Hope you're good.
Yes, yes. Nice to see you here.
Yeah, nice to see you in a different platform.
Good evening, Namrata ma'am. You're
And
on.
ma'am, please unmute yourself.
Yeah, good evening, Devakant.
Madam has come.
Hello, ma'am. How are you?
Hello, madam.
Hello.
Assalamu alaikum.
Hello, ma'am.
Assalamualaikum.
Assalamu alaikum, madam.
Down, madam.
Brother.
Hello, ma'am.
Hello.
Good evening, madam.
Again, just after some hours.
After some hours, even I was thinking that we are going to break all records now.
All right.
You are, we'll meet.
You make our program
Mm.
so updated.
Mhm.
Yes, ma'am. Here is Professor Unia is there. She is a very famous oculoplastic surgeon and a good researcher from Indonesia.
Yeah.
Dr.
Hello.
Unia.
Professor Hussein. I think we are meeting in the New Delhi on the last year. Did you remember me?
Ah,
Yes.
right.
Thank you.
How are you?
Fine, thank you. And how about you, Professor
I'm
Hussein?
fine.
I'm very happy to see you in here.
Here is
So nice
Dr.
looking.
Yes.
Well, looking so nice.
You are also.
Thank you.
Here is ma'am. Here is Dr. Victor Ko from National University Hospital from Singapore. He is a very famous researcher and a very young star in the National University Hospital, and he is the. I think you are now in charge of the glaucoma department of National University Hospital. No,
That's
you
right.
have just taken the charge. Congratulations.
Oh, thank you so much.
Okay.
Hi, Professor. How are you?
And ma'am, here is the Devakant Misra. He's the General Secretary of Young Ophthalmological Society of India, and he is doing very good. And ma'am is, the Asia Pacific President-elect Asia Pacific Association of Ophthalmology.
We all know her well.
Yes, yes.
Vikant, how are you?
Fine, ma'am. Thank you.
I have seen you in the leadership development program of
Yes, yes.
ICO.
Yes,
Yeah, right.
Great to have you there as well.
So it is already 8. I want to start because 2 of our panelists will join a little late. Professor Sharfuddin is in another meeting, very government official meeting, and Dr. Eli, she is not feeling good, but she will attend after 10 minutes. So I think it is Google time. It is 8 p.m. We can start within a very short time. Madam, আসিফ সাহেব আমরা স্টার্ট করছি, হ্যাঁ?
ওকে স্যার, রেডি আছেন?
The slide is visible.
Yes.
Yes sir, clear sir.
Yes. Yes, sir.
Respected guest of honor of this session, respected special guests, respected panelists, and respected young stars. Welcome to the session, International Webinar for Young Ophthalmologists, Episode 1. The term is Deep Shikha. In Bengali, it is Deep Shikha, let's preserve light. And this is our basic flyer. And why it is Deep Shikha, candlelight? We have planned it to name it as a candlelight. A little candlelight today can enlighten the world tomorrow. This is an encouraging term to encourage innovations and thought process of young ophthalmologists. They are our hope, they are our pride. Let's calculate our future. Now, I'm introduce our guest of honor, Professor Abha Hussain. She is Director cum Chief Consultant of Ophthalmological Society of Bangladesh, Eye Hospital. She is President-elect, Asia Pacific Academy of Ophthalmology. She is past President, SARC Academy of Ophthalmology. She is past President, Ophthalmological Society of Bangladesh. She is also Founder President, Bangladesh Community Ophthalmological Society. I am also delighted to introduce Professor Mohammad Sharfuddin Ahmed. He is the chairman and host of this session. He is professor and chairman, Department of Community Ophthalmology, Bangabandhu Sheikh Mujib Medical University. He is president, Ophthalmological Society of Bangladesh, president, Bangladesh Community Ophthalmological Society, president, Oculoplastic Society of Bangladesh. He is the past secretary general, Bangladesh Medical Association. He is president, Bangladesh Ophthalmic Research Forum. It's my pleasure to introduce Professor Dr. Namrata Sharma. She is Professor of Ophthalmology, All Indian Institute of Medical Science, New Delhi, and she is Honorary General Secretary, All India Ophthalmological Society. Our special guest and panelist, Dr. Santoshji Hanabar, he will join a little bit later. She is Director, National Retinoblastoma Foundation, Director, Department of Ocular Oncology and Ophthalmic and Facial Plastic Surgery, Center for Sight, Super Specialty Eye Hospital, Hyderabad, India. He is editor, Indian Journal of Ophthalmology. She is Dr. Yunia Irawati as a panelist from Indonesia. She is consultant, Jakarta Eye Center, Eye Hospital, Indonesia, Faculty of Medicine, University of Indonesia, Crypto, Mengung Kusmo General Hospital, Indonesia. He is Dr. Victor Ko. He is panelist and young star of Singapore. He is consultant, Department of Ophthalmology. Recently, he is the head of the in charge of glaucoma department, National University Hospital, Singapore. I'm really delighted to introduce in front of you Dr. Divakan Mishra as a panelist and young star. He is a consultant, Vitretina, IQ Super Specialty Eye Hospital, Lucknow, India. General Secretary, Young Ophthalmology Society of India, the Chief Editor, Young Ophthalmologist Time, India. She is Dr. Eli Pradhan. She is Medical Retina Consultant. She will be joined as a panelist. She is Medical Retina Consultant, Tilganga Institute of Ophthalmology, Nepal. She is Editor, Nepal Journal of Ophthalmology, and she is also Scientific Chair, SARC Academy of Ophthalmology. Now I am introducing our young speakers. Dr. Mominul Islam Badhan. He is Assistant Professor cum Consultant, Ispahani Islamia Eye Institute and Hospital. Our next speaker, Dr. Muhammad Ibn Abdul Malik. He is Assistant Professor and Consultant, Department of Vitro Retina, Ispahani, Islamia Eye Institute and Hospital. Dr. Sarah Rahman, she is also our next speaker, consultant and ophthalmologist and fecal surgeon, cornea fellow, Ispahani Islamia Eye Institute and Hospital. I'm really delighted to introduce Dr. Mahajiba Rahman Chaudhary as a speaker. She is consultant, cataract and refractive surgeon, Bangladesh Eye Hospital and Institute. Dr. Bipul Kumar Sharkar as a speaker. He is assistant professor, Islamia Eye Institute and Hospital. He is publication secretary, Bangladesh Glaucoma Society. Dr. Arif Hayat Khan Pathan. He is assistant professor, Retina, Ispahani Islamia Eye Institute and Hospital. He will also speak in this session. I am the moderator and organizer. I am Dr. Shams Mohammed Noman. I am senior consultant, head of glaucoma, Chittagong Eye Infirmary and Training Complex, member secretary, Bangladesh Ophthalmic Research Forum, general secretary, Ophthalmological Society of Bangladesh, Chittagong, council member, Sark Academy of Ophthalmology. So this is our plan actually. Introduction by host, 3 minutes. As host is not present now, she will talk later on. Speech from the guest of honor, 3 minutes. Speakers will talk 5 minutes, 6 speakers. Youngsters will talk 4 minutes, two youngsters. Questions and answer, panel discussion, experience sharing. Each panelist will get 2 minutes time before end of the session. I'm getting some added sound. I am requesting IT personnel to release some added sound. Thank you. Hello, our respected our special guest, Dr. Santosh Hanover is there. Hello, Dr. Santosh. I will please unmute yourself. I have already introduced you as a panelist and a special guest, and thank you for joining us. And so we have already started. I am requesting our first speaker, Dr. Mominul Islam Badhan. He is a UVA specialist from Islamia Eye Institute, and he will express his innovations. Dr. Mominul Islam Badhan, your time is 5 minutes, and now the time is yours. You can share your screen now. Unmute yourself, please.
Is it visible?
Yes.
Is my
Yes, visible. Clear.
Thank you, respected guest of honor, Professor Abha Hussain, Madam, respected Chairman, Sir, Professor Sharfuddin Ahmed, Sir, special guest and panelist, and organizer, Dr. Shams Mohammed Noman, Sir, and other speaker. Assalamu alaikum and good evening. Today, I'm Dr. Mominul Islam, consultant and assistant professor, Retina Department, Ispahani Islamia Eye Institute and Hospital. I will tell about smartphone-based fundus cam, a newer technique of capturing fundus photo. Smartphone being increasingly used among the health professionals and ophthalmological applications are widely available and can turn smartphone into sophisticated medical device. The modern update device is already available in the market. They are available. And this is my journey of my fundus cam in 2015 when I was first made this fundus cam by a plastic bottle. I will show you how to in 2015. This is a plastic bottle, and one side there is I add twitch adapter, and other side I attached. Other side attach I just mobile phone, and after that I took first picture with my device. which was in handmade, handmade and by plastic bottle, and first image kept by this device. After that, I kept screenshot and take the picture. After that, in 2018, I modified this device which is also available in different device design in various country. Then it is this procedure of capturing of image of new device that already in market in Bangladesh. Then I want to flashing mode we have to on. You can see the flashing mode continuously. This is the fundus scam that was in 2018, and there was this device also you can fix in the street lamp, this street lamp, and we can in the street lamp when we fix we can take the picture very nicely. You can see that video. We just fix this with a joystick in the street lamp. In the joystick, when I fixed it, after that I took some picture. You can see that picture quality, and after taking this picture, there's some picture that is this is traumatic or rupture cohort picture. This is a lattice. It is peripheral retina. You can see this which is captured by this device. There is a chorioretinal scar, very nicely taking the image. This is central retinal vein occlusion. There's a vasculitis retini. You can see the peripheral. This is another picture of morning glory syndrome, and there's a serpiginous choroiditis. After that, in 2019, I modified this picture, modified this device. Previously, we took this picture by street lamp. After that, I add some device. You can see that there is another accessories I use in this device. That is, there is a guard which is mounted with the device. You can see the video, which can open it and we can close it very nicely. By this guard, we can fix it over the chin. We can fix over the chin so that it will not it will be static and not vibrating the fundus cam, and there is very easily we can take the picture, and we can fix it over the chin, and easily we can take the picture. And this accessory is only 5 centimeter long from the entry surface of the cornea to entry surface of the lens. And this 5 centimeter, when this 5 centimeter will help to focus the retina very easily. And after that this device easily can picture. See, there is one accessory.
Honorable Speaker, 1 minute more.
Okay. Point to be noted that we requires some practice to take the picture, to capture this picture with this device. Well dilated people need clear ocular media. A cooperative patient. Smartphone apps allow adjustment of exposure and focus, control, and flashlight intensity. Thank you.
Thank you. Dr. Mominul Islam Badhon, for your excellent innovations. I think it is also introduced some other young ophthalmologists in the India, and you are the first introducer in Bangladesh. And it is also so much favorite and so much usable thing in Bangladesh for the retina specialist. And now I'm. Can you please stop sharing?
Yeah, okay.
So we have few questions from the audience, but I'm requesting Professor Unia is here. Dr. Unia, are you there?
Yes, hello.
Yes.
Yeah.
Hi, please take give a little comment over this.
Yes, I think congratulations for Dr. Mominul Islam. I think you have an excellent innovation. I think when I see you, you don't only an ophthalmologist doctor, but you have an innovation for the equipment. I think it's very important for us because we are, as a doctor, we also know about our equipment what we need. Yeah, I think you make it increasing the innovation from the bottle until you have some modified device. Yeah, with the chin fixation. I think the result is more accurate and then more focused, because sometimes I think if we only use with a bottle or not with a fixed stabilization, I think very tricky for beginner using the photograph not with the fixation. I think sometimes it's difficult to make it a good focus. But I think with your innovation now, I think is very wonderful. I think it's I'm agree it's very useful for all doctor. Yeah, especially when we have like campaigns in some rural area, and then we need some make a photograph for the retinal. Yeah, I think it's very useful for us. I agree with
This is
Dr. Norman.
it is very in affordable price also, and it can be you can share it by the mobile phone, and you can you can take live session. If you want to go for live video, you can take the picture also. And thank you.
Dr. Momin, can you please tell us what is the price in the US dollar in the whole setup?
Only device is $100, but you have to buy 20 diopter lens separately. And by this device, in pandemic situation, it is very helpful. You can take the picture from the other city also, from one city to another city, or one room to another room by smartphone mirroring. You can share it in the smartphone. You can who are the very older doctors, who are comorbidity doctors is there. If they want to take the picture of the patient, the assistant can take the picture from another room, and by smartphone, and that mobile phone with mirroring sharing option with the smart TV, and the doctor can examine the patient from the other room also, from other city also. And it also in the vision center, you can use in the vision center for telemedicine in now pandemic situation. So this is very affordable price, only $100 in Bangladesh. Already 100 pieces already sold out of this device. Thank you.
That's really very good news for us.
Is it already online? Did you know about that, or only in Bangladesh?
And I will send you, madam. Okay, no problem.
I think you can have international marketing, and I think this is also what do you think, Professor Namrata Sharma? He can start some research over it, and what is the efficacy and what is the actually strength of this instrument, and then compared to the other devices, then he can publish, and that I think it will be more easier. What is your thinking?
I think it's a great tool that he has devised himself, and then also given 100 commercially, which itself is a big thing. to first innovate and then to get it onto the market and then convince other people. So that itself is a big thing. But yes, I completely agree with you, Noman, that you could compare, between two people who are taking photographs and compare the quality of the photographs, etc., and do a publication of the same. So that is important, and I think extremely important when you make your own device like this is to have a patent on it. That is something which, as ophthalmologists, we don't work on it, we don't think about it. But as soon as you make something of your own, your patent application should be, going. Especially, if you nearly made it commercial, because you don't want anybody else to put a stamp on a device after copying yours or on a similar device. So very important for you to patent it.
Yes, madam.
I'm requesting Professor Abha Madam to tell on this device and what is your comment about this? Hello, ma'am. Professor Abha Madam. Hello. Hello. Hello, Madam.
Network maybe.
Hello.
Right. Congratulate. Can you hear?
Yes, yes, ma'am. You can tell. Hey,
Hello.
yes, ma'am.
Can you
Yes,
hear
yes.
me?
Yes, yes, ma'am.
I would like to congratulate Dr. Badhon for
Thank you,
his
madam.
great innovation, and I would like to support that Professor Narmata has told nicely that this should be published, and this should be one. Noman, you have told that one from India and Bangladesh, Badhon from Bangladesh. Is this all the same type of device?
Badhun.
Yes.
Badhon, this
Yes,
is
madam.
almost same type of device.
Yes, madam. That the Dr. Ashish Sharma made this type of device that was only for iPhone, and that was previously he made that only handmade. That after that I just took his one design, that is I made this for universal, that you can take this mobile phone, any mobile phone you can
Any mobile phone, and anywhere this can be used. Yes.
And it can be fixed in a slit lamp, and there is another guard that is given in 5 centimeters, which can help to fix, to stabilize the device, which is also introduced newly, which was which is not available in any device in any country. That
Okay, that is this is only your innovation, and this
for
is a very
stability.
right. So for the retina surgeon, for the retina specialist, medical and both surgical, it is very much helpful for them.
Yes,
and for other person also interested to see fundus, so it will be very much helpful. And I think as this price is very much reasonable, as because it is only $100 for everybody, and already Dr. Unia has wanted in online. So I don't know. Professor Namrata can tell that whether he can sell from now on. Professor Namrata.
I think he would. I mean, of course, you cannot. It will be difficult for you to do it. You, being an ophthalmologist, we cannot do it. The best way then to do with this is that you liaison with a company person. Could be any company. That's the way they do it. I mean, you can get, for instance, in our setup, they would liaison with a company like Swami or any other company, and the company will
Yes.
market it for you.
Right.
Yes, madam.
Company will do the distribution
Yes.
for you.
Yes, madam.
That is the way. Yes. Thank you. Thank you so much, Badhon, and thank you, Noman, for this webinar to celebrate the young ophthalmologists for their innovative work. So thank you so much, Noman, and also thank you, Badhon, for your innovation.
Thank you, madam.
Thank you. So I'm requesting our next speaker, Dr. Mohammed Ibn Abdul Malik. He will tell on my research journey. So I'm requesting Dr. Santosh Hanover, because we will hear something from you after this, after his presentation.
So is my screen visible?
Yes.
একটা মশা মানে এমন করে কামড়ালো মুখের কাছে আসছে এরকম করে আমি এখন অফ করে দিচ্ছি
Okay, you can start. Unmute yourself.
It's just a publication that I did last year, and it's something that I want to speak about. So first off, what we can start with is, why do we do research? So simply put, we do research to identify questions in clinical practice that need to be answered. And how do we get those answers? By designing appropriate research methods and well-designed clinical trials. So often there's a focus on the publicity and the hype behind publications, but that is a byproduct of research. But the ultimate aim of research is to add something to the public domain. So how do we? First way is we have to be inquisitive. We have to be curious. So we have to ask questions, and based on those questions, we have to make specific observations and see what has or has not been done. So what we do has to add value. That's why what we publish should be meaningful. So research what we clinicians, we usually think of clinical research as research, but it is important to understand that basic research also forms an essential part of research. So for example, speaking from retinal perspective, I'm a retinal consultant. So the clinical research into anti-VEGFs would not have been possible if VEGF had not been identified as a chief factor in the pathogenesis of neovascular AMD and diabetic retinopathy. So that's how research should be. So to that end, what we sought to do was we sought to showcase the potential for research in basic research in Bangladesh. And what we chose to showcase was genetic research. So we published this last year in a Springer book, Advances in Vision Research. So what we titled it was Challenges and Opportunities in Genetic Research from the perspective of a tertiary eye care hospital. So basically what we did is we chose a 1-year period, and of all the patients that presented to the vitreoretina and glaucoma departments, we just highlighted some important cases that have potential genetic implications and could be a basis for research. So it was interesting to note that the period covered was June 2016 to July 2017. And what we saw that of the 50,000 patients who presented to the vitreoretina department, what we showcased was that 2.5% or about 1,300 patients were those of retinitis pigmentosa, which has a well-known genetic basis. So these are actually for genetic diseases which are not very high in numbers. This is quite a large number and a large basis for research. It was interesting to note that while AMD is the largest, it's the research question in the Western world, only 4% of our patients presented with AMD. Whether that's due to some specific genotype differences or whether it's just that patients tend to present less, that is also an area that is right for research. So that is how we presented the scope. So what are the challenges? So there are some perceived versus actual barriers. At present, we have limited research capability, which is gradually improving, which is actually rapidly improving. And there is a lack of priority for research because we have a huge clinical workload. So we tend to focus on more on the patients, but we have failed to realize that clinical research ultimately serves the ophthalmic community as a whole. So we had a lack of specific research mentors, and that is also rapidly changing. And at present, funding for large-scale research is limited, but that's because we haven't actually presented research of value, which would attract funding. But one of the primary problems that I think is that we are not introduced to research early enough. So basically, I learned of research in my second year of ophthalmic training, which I think, frankly, is quite late. I think there should be a focus on introducing research methodology in undergraduate education so that students are aware of it earlier, so that they know what they have to do and they are interested in it, and they aim to do it as soon as they graduate med school. So I think there is an awakening among our young trainees into the importance of research, and it is the hope that the level of ophthalmic research will increase by leaps and bounds. And it is the era of COVID. This webinar is testament to that fact. But while devastating, it has brought our ophthalmic community closer. Like we have people from so many different countries here, and there is an immense potential for mentoring and research collaborations across the globe. And I'm at the very beginning of my journey, and I hope to go a long way in this potential. And I thank you for your attention. And again, I would like to thank the Bangladesh Ophthalmic Research Forum for allowing me to be a part of this webinar. Thank you.
Thank you, Dr. Mohammed Ibn Malik, for your excellent presentation. And you have already told your research journey. I think we can discuss one matters. We have some residents, they're asking some questions that a resident or any clinicians in a very early stage, they have to do their clinical practice in the clinic, and they have to, they want to do research, and they have some academic responsibilities, and also a lot of things they have to do in a tertiary eye care center. So how can, so sometimes they have to sacrifice research to do, to taking the responsibility of clinical activities, clinical burden. So what about this matter actually for the beginners? How can they start their research, or even those who are very much busy clinical practitioners, how can they will manage a time for the research? Dr. Santosh Henover. Sir.
I think you brought out a very important aspect of clinical practice. If you are a clinician, then often you don't find time to write up or document. But as some of the youngsters have actually been doing, one example is Divakant, the other example who was a youngster now is the authority, Dr. Namrata Sharma. They have always built in documentation, good documentation into their clinical practice. So automatically every patient gets documented very well. So at the end of the day, if you have an interesting case, you really don't have to struggle for photographs or documentation. You have it all. And over a period of time, you collect a series and you write up a series. Any case that is presented at a grand round, for example, all postgraduates have grand rounds, and anything that is presented in a grand round is a publishable material. It may not be in a very high-end journal, but even a national journal or a state journal is good enough beginning, right? So if you have a series over a period of time, you can start presenting it. You'll have a podium presentation, things like that. You build on it. And if you have a rare clinical situation and not many cases of that sort of published, you can ask people around and collaborate. Somebody might have seen two of similar cases. You put it all together and make a nice review article. So there are wonderful opportunities, but it is the inclination that matters. Time is always an issue, but if you have the inclination, you have the time. If you want to write, nothing can stop you.
Thank you. Thank you. So what is your comment, Dr. Devakan?
Yeah, thank you. So yes, Dr. Santosh Nawar has said it all. But I realized that in busy clinical practices, what we need to realize is that even very small cases get published. Things that we think might be really simple. So to cite an example, I got a case referred from somebody as a macular hole, a pediatric traumatic macular hole. The patient took some time and reached me on the 6th or the 7th day. So, but when I examined, I didn't see a macular hole there. But I again talked to the referring doctor, and he said there was a macular hole, and he shared the OCT. So we realized that there was a spontaneous closure within 6 days. So, and that case landed up in American Journal of Ophthalmology. We were able to publish that. So something which we might think that it's quite simple also gets published. So always keep trying, keep persisting. And at times you have to try in different journals, and multiple attempts are required to get something published. So perseverance is also a key. Keep trying.
Numan, if I can just add one line.
Yes, yes.
I think it is your name which, kicks everything. If you have a publication, if your name appears in a publication, in one publication, then you want to see it again and again. And Santosh, I think very rightly put it, that it has to be only something different, a different indication, a different, complication, a different innovation to get published. Santosh would know, he's doing a great job as editor, IGO, publishing what really clicks. But you have to just do something differently. That is what I think the editors like Santosh are also looking at. And like I said, once you see your name in publication number one, you want to see it again and again. But it is so surprising that even at this age and this stage where, Santosh is and probably where I am, even if I see a name now also in my, paper, I like it. I mean, it's like that. So I think 1 hour a day or half an hour a day, if you give to just, you have to compartmentalize. You can't say that every day you eat, you sleep, you get up, you do all your activities, you take a bath. Likewise, every day you do clinical work, academic work, research work. It has to be like that. There is no
Thank you.
sequential mode, it's a simultaneous mode.
So it should be within our routine practice, routine days works.
It would be within
Thank you.
practice, yeah.
Thank you. Now I'm inviting Dr. Sarah Rahman. She will talk on a very interesting thing, difficulties facing during publication. Dr. Sarah Rahman, next 5 minutes is yours. You can start your presentation.
Thank you, sir. Am I audible?
Yes, you are audible. You can share your screen and you can.
If
Yes.
my screen is visible?
Visible. Yes,
Yes,
this is visible.
Okay, sir. Assalamu alaikum and good evening. I'm feeling very privileged today to share my experience in this excellent platform, and I would like to share my gratitude to Bangladesh Ophthalmic Research Forum and also Professor Abha Madam and Shams Mohammad Noman sir for giving me this opportunity. I would like to start my presentation with a quotation from the great Nelson Mandela. It always seems impossible until it's done. Research is that much difficult? So today my presentation topic is difficulties facing during a publication. I am Dr. Sarah Rahman, working as a cornea fellow nowadays in Islamia, Ispahani Islamia Eye Hospital and Institute. Today I will discuss on the basic problems that an amateur researcher face during the journey. 7 key points will be discussed. So before starting a research journey, at first we have to do some baseline work. This is the first thing. For a baseline work, we have to keep our documentation. Usually our country is a little bit lag behind in documentation. So I personally think that we should maintain our personal logbook and keep the data and the literature review. Whenever we think that we should go for this research or topic, we have to go through a thorough literature review. The second thing is research methodology. A researcher must have a good knowledge about the research methodology that should include a good methodological approach, method of data collection, methods of analysis, evaluate and justification of the methodological choice, and tools and materials used in the research. So number 3 is the writing of a research paper. So that is the core thing about research. So whenever a researcher think about writing a research paper, the contents should be important. The first one is title. Title must be simplified and it should reflect the whole research paper. Author information, abstract. It is the summarization of the total research paper that should not be exceed more than 250 to 300 words. Introduction, methodology, result, discussion, conclusion, value statement. So this is something new in the quality journal. So what these research paper add to the community of the ophthalmology or community of the medicine. Acknowledgement and the reference. So this is the third point. Again, after we have completed our writing of a research, we have to go through the plagiarism and the spell check. So once that Stephen Wright told that to steal ideas from one person is plagiarism, but to steal from many is research, which is a common phrase used between the researcher. After the plagiarism check and the spell check, we have to go to the writing format. We have to choose whether the British style English or American, and we should not mix this up, and we have to keep our research language simplified. It's like a storytelling. And the referencing software, it makes the life of the researcher easier. There are some research related software like RefWork, Zotero, EndNote. I personally use EndNote, Mendeley, and the citation site. And the referencing style, we have to choose one in between APA or Harvard or Vancouver MLA or AGPA. So this is the thing about the writing. And the fourth thing is collaboration, as my early speaker showed about the mentor. So at first thing, for a better outcome of a research, we have to collaborate with the some association, like a good biostatistician. Recently, I have submitted a journal to Journal of the Cataract and the Refractive Society. So there it is clearly written that any mistake regarding the statistics should not be accepted in a quality journal. So we should take help from a professional biostatistician, then help from expert. Regarding my choose topic of the research, we should take help from the biostatistician, like Dr. Divakant told that whenever there was a macular hole, he took help from his mentor. So we should take help from the regarding expert panelists. And networking is very important. This is the baseline of a researcher. A researcher must have an ID in LinkedIn, Orchid ID, and Google Scholar, so that any researcher can find him. And last but not the least is the PubMed. PubMed is the like a national library for the researcher, and the journal we should choose must be PubMed index journal. So number 5, after I have completed my writing, now what is my question? Next question, that which
Honorable
journal,
Speaker, 1 minute more.
which journal I should choose? So for this we can use a search engine. Usually I use the Simago journal ranking. They rank the journal according to their impact factor. I must suggest that we always choose the first quality journal. Even if we got rejected, we got a very good review that will help ourselves later on. Number 6 is submitting in the journal. After I choose the journal, I should go to the author guideline, and then there is a total guideline given. Then conflict of interest disclosure, financial support, ethical approval, article type, whether this is a technique or procedure, and the final thing is figure tables. This should be in appropriate method. And the number 7, after I have published the paper into a journal, I should wait for the review and then address the reviewers' comments carefully. We have to correct our paper according to their review, and then finally submit following the guideline. If one researcher should follow these 7 steps, then he or she can go to achieve their goal. So this was my first publication. It was published in Elite Journal of Medical
Your
Research last
time is
year.
over.
And so the key to success is not through achievement, but through enthusiasm. So don't be the same, be better. Thank you for patient sharing.
Thank you, Dr. Sarah, for your excellent presentation and your experience and your journey towards research.
Thank you, sir.
So, hello. Have you stopped your screen sharing?
Yes, sir.
So I cannot see the. Okay, thank you. So I'm requesting Dr. Eli Pradhan. I know you are quite sick. Still, I'm giving you pain. Dr. Eli Pradhan, what is your comment about her presentation? Because you are dealing a lot of responsibilities about the Nepal ophthalmic research, and you are the editor-in-chief in the Nepal Journal of Ophthalmology, and you are also taking the responsibility of Sark Academy of Ophthalmology Scientific. So what is your comment?
Thank you, Dr. Noman, for this excellent opportunity. And, really, Dr. Sarah Rahman has, very much simplified, but, explained in a more elaborately the way to write a manuscript and, how to go with it. As Dr. Santosh and Namrata ma'am said, research activities should be a part of your daily activities, like, other clinical part and all, before you're submitting once you've done your groundwork, everything, you need to choose a particular type of journal, and you might get rejected many times because if it is not under their guidelines, you will get rejected, but that shouldn't get you disappointed, because getting into a proper and good journal and getting published is the main important for you as a young researcher. So you need to look for which, according to your manuscript, you need to see which journal fits into that. And then once you submit, even if it is rejected, go into reviews and ask for the reviewer's comment, and you change accordingly, resubmit. And even if it gets rejected, you submit into the other journal. So that is the way to go ahead. And of course, as Namrata ma'am said, if you publish one, that will make you more happy, and you would like to do more publications. Thank you very much, Dr. Sarah.
So somebody, it is called the research addiction. So it's you have to be.
Numan, I am Professor. Can I ask a question to Traili? Numan?
Yes, sir.
Yeah, Ellie, I'm Professor Anisu Roman. Just in your journal, you told that is Harvard style. Yeah?
Yeah.
Most of the journal follow Vancouver.
Yeah, yes, I know. Yes.
Most of the journal. I have submitted many articles. And one, you can remember that I have submitted an article to your journal, but I missed the referencing system. I given it Vancouver style, so I told you that just omit the Ujjoma journal, just because that is the reason that I missed the what is the style. Just but after that I see clearly that it is written here that Harvard style.
Yeah. Yes.
Can you remember?
Yeah. Yes.
It is a dengue related paper. First I submit to you, then I told please withdraw my paper, because after submitting
yes, now I remember. Yes. Because our referencing system is slightly different, because most of the journals, they go with Vancouver, and ours is like, it's not, because I've joined a couple of years ago, and the previous editor and whoever has made that has like the committee arranged it like that. So in order to change the whole system, I'll have to do another major thing. So whatever has been happening, so we just continued with Harvard system.
We're also accustomed to the Harvard style, but most of the journal told that Vancouver, so it is my great mistake. So I withdrew the paper. Not just no other issue. Just thank you.
Thank you, Professor Anju, for your question. And what about this research and research journey, Dr. Victor? What about the presentation? Those who wants to do research, what they have to think in a very primitive way. Hello.
Yes,
Dr. Victor.
Dr. Norman, yes. Dr. Sarah, thank you so much for the talk. I enjoyed it a lot, and it brings me back to medical school days. In Singapore, since medical school, we will have to start writing papers. So we will have to go through the methodology, and we went through biostatistics. At the time, really, I don't have any interest in research, I must admit. I skipped my lessons, I skipped my school. I didn't know how important this is, and I regretted that. I regretted that because I think we are moving more and more towards, I personally am moving more and more towards academic medicine. And so, it's difficult. I'm not going to say it's easy. When I try to inspire my junior colleagues, I tell them that initially it's hard. But I think, as with anything new, once you go past the learning curve, you'll find that it's going to be easier and easier. And
fast publication is the most difficult.
So I tell
I think, because you have to give a lots of time.
Certainly. I tell myself certainly that any publications can be published if you find the right journal. So you can get rejected, that's fine. You have to be thick-skinned. Yeah, and you just keep improving. You'll find a journal that accept your paper.
I think, Dr. Victor, that's a very important thing that you said, that you have to find the right journal. You have to choose the right continent. You have to choose the right journal. You have to choose the right category. Sometimes what doesn't get published in case series will get published in surgical technique. And it should always be on the net. No, that's what I feel. No article should be there in your computer. The ball should be always on the internet in the editor's code rather than in your code. So don't try to perfect it and waste your time on it. Just send it over. I mean, that's the most important thing.
Yes.
What happens is, we tend to think, okay, we'll, perfect it, we'll perfect it. Okay, do perfection to a reasonable degree and just send it off. As soon as it comes back, 48 hours and send it somewhere else. Because
Yes.
otherwise you will keep feeling bad about it. You will
Yes.
not feel rejuvenated, or you will not feel happy until you throw the ball in somebody else's court.
Yes,
So within, that is the rule that I follow. If some article comes back to me within 48 hours, it should go again from my computer. It cannot stay there. And once you've written is published, think like that. Once you write something, it will definitely get published. Once,
Perfect.
twice, 3, 4, 5 times. One article of mine took 17 times to publish. 17 journals it returned back. But still I saw to it that, in the 17th one it got published. That will only happen if you keep, sending it at various places. If you keep brooding on it, it will not happen.
Thank you, ma'am, for your encouraging comments. I think this is
good lesson for everybody, right?
Yes, and I think this you have to take it like a war. So I'm requesting now Dr. Mahjiba Rahman Chaudhary to start her presentation. Her presentation on Manjari as a refractive surgeon. Dr. Mahjiba.
Is my screen visible?
Yes.
A very good evening to you all. It's an honor to present among the mindset of Professor Ava Madam and such a rich panelist, and a special thanks to Dr. Noman for having us here. So we will switch the gear a bit, and now I'll just share my journey, how I became a refractive surgeon, so that maybe we can encourage the youngsters over here to maybe think a little differently or to start something new. So when I finished my long-term cataract fellowship, there was a question, now what? So because I wanted to give the patient a complete roundabout refractive service. Then a great opportunity came. I got the privilege to do a fellowship under one of the greatest refractive surgeon, that is Dr. Rohit Shetty. And I just want to pause here a bit. And for all the females out there, it's always difficult to balance your personal life and your work. But when such an opportunity presents, we must take it, because in the end, the road follows you, but please don't miss out such opportunities. So let's get back. So the first thing about the refractive, how is it different from others? It's the planning. You have to give more chair time, more counseling has to be done to the patient, because they might have some unrealistic expectations. So you need to solve those. And you have to have a very good understanding about your pre-op evaluation. Why? Because you need to understand which patients you have to avoid refractive surgery and which patients you want to do. And even in those cases, which surgery is suitable for that patient. Refractive is still not very common in our country. So I'll be just sharing some videos of what we are doing. The first is the femtoLASIK. So how is this different from the normal microkeratom LASIK is we don't use the blade over here. The femto laser is used to create a flap. Once the flap is created, then the rest of the surgery is pretty much the same. We move the patient over to the examiner bed, lift the flap, and then the ablation is done. Once it's complete, we again put in the flap, and voila, the patient is happy and the surgeon is obviously happy. Next, I want to talk about another surgery, PRK. It had lost its charm in the early 90s because it's called severe pain and haze. But now we know how to tackle that pain. We know how to tackle that haze. It's coming back in a big way because this patient, the cornea was thin. It was around 450. So I had opted that, no, I will go for PRK in this patient because that would be more safe for the patient. After PRK, I will be talking about something new that we are doing, that is the smile surgery. How is this different from LASIK is that over here, instead we don't create a flap. What we do is we make a lenticule. Once the lenticule is made, then it has to be separated and completely from the intact cornea and removed. So how is this different? Again, there's no flap, and second, this is more biomechanically stable as research shows. So this patient, he had a high refractive error of -8, and he was very much into contact sports. So in order to avoid any flap related complications, I opted for SMILE here. And as we are saying that now I'm removing the lenticule where it comes out, and then the surgery is done. Lastly, when all fails, there is nothing I can do. Still, there is a way out. That is the IPCL, that is the implantable phakic contact lens. I'm giving the ICL, the Indian version over here. So this patient had -15 in both eyes. So I had opted for an ICL. We just put in the contact lens over the lens, tuck in the edges under the iris smoothly, and the surgery is done. Then comes the question, so why do you want to choose this field? Why refractive surgery? Because this is a demand of the times. Now more and more patients are opting for refractive surgery. So we can think about it. And next, there's an instant wow factor. The patient is instantly happy. But saying that, you have to be careful because you're working on the eyes of a patient who has 6/6 vision. So you need to be careful in the planning so that you can give the best outcome. So with this, I will end my presentation. Thank you.
Thank you so much, Dr. Sarah Rahman, for your excellent speech. It's a very great journey over the as a refractive surgeon. So I am requesting Dr. Professor Narmada Sharma to make few comments over her surgery, and we are really very proud of her. She is a very good refractive surgeon in this age. So I think you are the best person to comment over her. Please unmute yourself, ma'am.
Excellent surgeries, Baziva. Very nice. All the surgeries beautifully shown, including the SMILE, which is a little more difficult as far as the surgical skills is concerned. And so great, keep it up. And nice that you actually, took time to train, get yourself trained, and then come back. And very rightly said, this time will not come back to you for training, for learning, and for fellowship. So if you have the opportunity, please don't miss it. Very nice.
Thank you so much, ma'am.
So what is your planning, Dr. Majiba, about, you can do some research over this, you can compare to the different status of the surgeries and different modalities of different refractive surgery. Do you have any plan?
Thank you, Dr. Noman, definitely. And I think platforms like BORF can help us to, because what we do is we have the data now, but we don't know how to move forward. But maybe platforms like this can help us to move forward with our research work.
So I'm just giving you one idea here.
Yes,
people generally compare LASIK and SMILE. Okay, one is a surgery which has a flap, and the other has a surgery which is a cap. In both, some kind of incision is being made. There are very few studies or no studies if you go to the literature and compare PRK with SMILE in low amplitude of refractive error. So it's like a flap surgery and a flapless surgery. So if you compare that, I'm sure it's going to get published with whatever samples you have.
Yes, excellent
Thank you
idea.
so much, ma'am.
Majiba, you should do.
Yes.
Yes. I think all the panelists, they are ready to assist you and also guide you. So no worry. I think with this platform we can plan your next research project. We will help you, inshallah. Thank you. So I'm requesting our next speaker, Dr. Bipul Sharkar. He will tell on Road to British Journal of Ophthalmology. Road to British Journal of Ophthalmology, the blood, sweats, and tears. Dr. Bipul, the time is yours. You can start your presentation.
Yep. Yes, my slide is visible.
Yes, visible.
Thank you, my respected panelists, my teachers. Welcome to all my presentation. Actually, very recently, one of my article has been accepted in British Journal of Ophthalmology. Today, I am going to share that experience with you. Actually, I had a dream to publish one of my article in British Journal of Ophthalmology because it is a high impact journal, and position is 8th position in Journal of Ophthalmology. It is indexed by most of the indexation services, and there was no article processing charges with hybrid open access option. At the same time, it is monthly published journal, and their average time to decide within 19 days, they will take the first decision regarding the journal. But my main obstacle was their acceptance rate was only 17%. That means 73% cases they reject the article. I was worried, but I know I have to do it because I had a strong study content. It was on a rare disease, Sturge-Weber syndrome. And in Sturge-Weber syndrome, my patient 30 to 60% cases developed refractory glaucoma, and that cases we need to do surgical intervention. And I compare two surgical technique, trabeculectomy versus Ahmed glaucoma valve implantation in that cases. And I had a long 3 years follow-up data. And when I analyzed the data, I found there is a significant reduction in intraocular pressure in both cases. At the same time, I did the Kaplan-Meier cervical analysis, and I found that both surgeries was successful for reduction of intraocular pressure in patient with Sturge-Weber glaucoma. Then I started my work. I read the author guidelines carefully, and I wrote the manuscript properly. I need to open a Scholar One ID to submit the article in journal, and they recommend every author should have ORCID ID. Already I had this, and I wrote a cover letter. And finally, I logged in my portal and I submitted journal successfully. And just after 3 days, they returned my article, and it was expectable because I found there is some technical issue. I found they only demand my ethical approval ID. I contact my ethical committee and provided it, and again submitted. And day 17, they emailed me on regarding decision of my manuscript. I was thinking what will be the result, and I found they recommend the major revision. But I was happy that time because most of the reviewer had a good comment regarding my journal, like methodology. They told that this is a very interesting cases. I revised and again submitted the journal. But just 2 days after they again returned my article, I found I was thinking what was the problem, and I found that they requested to upload my research checklist. Then I uploaded it. Writing guideline was followed in my study, and also I found that they recommended to provide that my institution name is not in Ringgold database. So I contacted the Ringgold and to update their database and to make list our institution, and then I again submitted for review. And day 21, they again returned my article. So I was really tense, and what was the problem? And I found that they again checked article plagiarism checked, and they found that my overall overlap of the text is 45%, which is higher than their accepted level. And when I went through my article, I found that they counted every word, because I know every article was written by me. I know I didn't copy anything and from any journal, and I properly reference everything. But I found that they count everything. Like Ahmed Glukomov, they also counted it. Even my residence address, U3, they also counted this. My institutional name, author name, they also counted this. That time actually really I was very shocked. But I believe my faith, keep my faith that it should be done. And again I rephrase all my article and again submitted for review. And day 35, they again emailed decision on my manuscript, and I found they recommend very minor revision. That times I was thinking something maybe happen. And on day 35, I found that they again emailed regarding decision of my manuscript. I found my journal is accepted. So actually my dreams comes to And I really love to see our name like this. And thank you so much. Thank you.
Thank you, Dr. Bipul Kumar Sarkar, and congratulations. And ultimately, you did it. Congratulations again. So I'm excellent presentation. I'm requesting Dr. Santosh Sanavar. Are you there? Dr. Santosh?
Yes.
Yes, please make some comments because it is really tough to publish in the IGO also.
No, it's never tough. I think he had a very good methodology.
Yes, I know.
Rare disease without any reliable treatment. Trabeculectomy has its own complication, and
Yes.
even valves have, shunts have their own complications. So he compared both the modalities, and he found that they were equally good in terms of IOP control. Your methodology is good, and you take a rare disease which is probably more prevalent in Bangladesh and India and Asia than in UK, and give a good kind of a recommendation or a show that two surgical modalities are comparable. I think that is very reassuring for a individual who sees these patients very rare. So
Yes,
this stood a very good chance of publication because it's a rare disease and the study was done well.
Thank you.
Thank you, sir.
Dr. Victor, I was just watching. You enjoyed the whole presentation, and you have. I know you have a lot of comments on this because you are doing a lot of researches and you are guiding a lot of researches.
Maybe we should ask Dr. Santosh to give you some tips on how to publish easily. When you submit. I always feel that writing the paper is easier than submitting the paper to a journal, because each of these journal will have their different formats, different systems of submitting paper, the different formatting. I find myself spending a lot of time, looking at the formatting, because any single mistake that is not in line with what the editor wants, they return back to you, isn't it? So Dr. Bipul, congratulations, well done. I'm very happy for you. Hopefully this is the first of many, right? And I think really once you went through one process like that, you have learned so much. The second paper and the third paper and the fourth paper will become easier and easier and easier, because I remember when I first published my first paper in 2010, and I submitted my paper to my mentor, Professor Angkin, for internal review. He practically rewrote the entire manuscript. That's how lousy I was, and he went through the entire manuscript, and through that process, right, you learn so much, and the second paper became easier, less rate marks, less editing, and it became much faster. So congratulations, well done.
Thank you, sir.
Thank you, Dr. Bipul. Do any comments from Madam, Professor Ava, Madam? Are you there, Madam?
I would like to congratulate people, as because nothing in life is worthwhile unless you take the risks. And so many times rejected, not rejected, but review, and after that it has accepted. So it's a long journey for you to be published your manuscript in the British Journal. So we feel proud of you, as because really you are a very good glaucoma surgeon and you deserve it, as because I have seen you in our award session, how nicely you present your presentation, and ultimately you awarded the gold medal. So in British Journal of Ophthalmology, it is, of course, you deserve it, though so many times. It should be the way, otherwise only you submit and they will publish. It is not the easy way. So every word, every line they have checked, and ultimately they have accepted your paper. So it is very nice, and we are proud of you. Thank you so much.
Thank you, ma'am. So I'm requesting our next speaker, Dr. Arif Hayat Khan Pachan. He will now, Arif Hayat Khan Pachan, the time is yours. You can start your presentation. I think he will show his one very interesting case on retina. And
his slide is visible?
Yeah, visible.
Yes.
Yeah. Thank you. I'm Dr. Mohammad Arif Hayat Khan Pathan, working as Ispahani Islamia Eye Institute Hospital as a assistant professor. At first, I'm very much honored to present here, and I like to show my gratitude to Professor Abha Madam and also Dr. Shams Mahmoud Numan Bhai for arranging such a high voltage webinar. So I'm going to present one of my article that is published in European Journal of Ophthalmology. Though it is not my subject, that is a palladium-103 plaque radiation therapy for ciliary body melanoma through a functioning glaucoma filtering blade. So I am the first author, and along with there was Alexander Boras and Lawrence Bittina and Paul T. Finger. So my article is published in European Journal of Ophthalmology. It first published in September 23, 2017, and then European Journal of Ophthalmology is a very prestigious journal which is issued in bi-monthly and first founded in 1991. It only publishes reviewed original research reporting clinical observations and laboratory investigations with clinical relevance focusing on new diagnostic and surgical techniques, instrument and therapy updates. It was a case report which is published in EJO, and along with me there was Alexander Boras, Lawrence Vitena, and Paul Finger. And all are working in New York Eye and Ear Infirmary of Mount Sinai, and this is published when I was working as a fellow in New York Eye and Ear Infirmary. And I am grateful to Dr. Paul T. Finger, who is a corresponding author and the chief of ocular tumor service of the New York Eye and Ear Infirmary, and who gave his case to publish, and Dr. Alex Boras, who was with me in this journey. So in our cases, we examined an unusual cases where a radioactive plaque was placed on top of a functioning filtering blade. During treatment of a subjacent ciliary body melanoma, while there was a risk of damage to conjunctiva, this technique offered a chance to spare the filtering mechanism. So a 75-year-old woman was referred from the glaucoma service to the ocular tumor services, and he was diagnosed as a pseudo-exfoliation glaucoma for 17 years, and he had history of argon laser trabeculoplasty and trabeculotomy in the same eye. She had good vision, 20/25 vision, and IOP was also controlled, that is 12 millimeter mercury, and otherwise the conjunctiva was bullous over a well-functioning bleb. So this is the picture. This is the picture of her. There was a well-functioning bleb in the right side, and also there was a scleral hyperpigmentation, which is indicator of the ciliary body melanoma. So UBM was done, and moderately low reflective ciliary body tumor that involved the ciliary body extending to the iris root, and the diameter was 6.5 millimeter in transverse and 6.3 millimeter in length and 2 millimeter in width. So the patient informed consent was taken, and decision of the risk and discussion was done between the risk and relative benefits of observation, radiation, and accessional surgery or enucleation. At last, radiation was decided, but the challenge was the bleb sparing surgery, because if we place the radioactive plaque over the cornea, so there is always chance of destruction of the plaque, and the glaucoma filtering mechanism will be halted. So the problems may be solved by the amniotic membrane graft. So amniotic membrane graft, the plaque was affixed to the eye wall over the targeted zone, and then 5G absorbable suture was given. Then we lifted the anterior aspect of the plaque to slide an unsutured 10 to 15 millimeter wide into the epithelium, and finally another thick amniotic membrane was given to the conjunctiva to create a previously unreported and novel amniotic membrane cover over the back of the plaque. So this is a documented picture where we can, so if this is the eye and this is ciliary body melanoma, so before placing the radioactive plaque, Dr. Paul Finger placed a amniotic membrane, and after that he placed a plaque, and then again the amniotic membrane that is thicker. So the plaque remains in between the embryonic membrane. So this gives an extra advantages that eyelid to glide over the plaque. The large size of the second amniotic membrane allowed us to avoid suturing the conjunctival bleb and protect conjunctival tissue from the radioactive device. After 1 week, both the radioactive plaque and amniotic membrane grafts were surgically removed. The result was very nice, very excellent, and that is 2 weeks after plaque explantation surgery was done, her bleb appeared functional, and intraocular pressure was also maintained, that is 14 millimeter mercury, and UVM showed tumor regress. So this is the post-op picture, which shows that if we compare between pre-op and post-op picture, you saw the tumor is regressed, and the conjunctival swelling because of the ciliary body tumor also reduced in size. So there was some little complication, that is minor plaque-related short-term keratopathy that is relieved by medication, and a late sterile blebitis also happened. That
Honorable
is
Speaker, 1 minute more.
with topical antibiotic for 1 month. 6 months later, she developed a hyphema resolved after 1 intravitreal bevacizumab injection. And so the conclusion is the radioactive plaque therapy has largely replaced iridocyclectomy in the treatment of ciliary body melanoma. Plaques have several benefits over more invasive surgery, and long-term risk of radiation-induced cataracts is high also. So there are no reported radiation-related impediments to their surgical rehabilitation. So this is my reference, and thank you very much for patience hearing.
Thank you, Dr. Arifat Khan Pathan, for your excellent presentation and innovations. So I think Dr. Santosh Sanowar is the best person to discuss and comment on this. Dr. Santosh, over to you.
Well, I mean, plaque brachytherapy is a standard of care for ciliary body and choroidal melanomas. Here, there was a difficult situation because there was a pre-existing bleb. And the technique used is very nice because the bleb was preserved ultimately. Otherwise, if the tumor was cured and the pressure remained high, then the possibility of doing one more relocating the bleb would have arisen, which is not a good thing to do in an eye with intraocular tumor. Right. So this was a very innovative technique and it worked beautifully well. Congratulations.
Thank you. Dr. Devakant? Dr. Devakant is there? Hello. Yes.
After Dr. Santosh has spoken, I think I should not comment on the case, but yes, excellently worked up case and managed and presented in a wonderful journal. And it also highlights the importance of exposure, international exposure as well. So I would also highly recommend getting exposed to these great institutes and working under great mentors. So, congratulations.
Thank you.
Thank you. Thank you. Now we have two young stars with us, Dr. Victor Ko from Singapore and Dr. Devakant Misra. So our Wesleyan and our young stars from Bangladesh, they are eagerly waiting to hear something from you. I am requesting Dr. Devakant Misra to tell something, to tell your journeys and your techniques to become a star. Thank you.
I have a few slides. If you allow, I can share them. Are my slides visible?
Yes.
Okay. So thank you once again for this wonderful opportunity and making me a part of this wonderful webinar. It has been wonderful so far to hear all the excellent presentations and what wonderful work Bangladeshi young ophthalmologists are doing. Dr. Noman asked me to just give an inspirational talk, a motivational talk for the young ophthalmologists. So young ophthalmologists are bombarded with a lot of expectations, learning good surgery, absorbing so much of ophthalmic knowledge, trying to publish and present their work at best forums possible, find a good job, establish a hospital, and maybe acquire some leadership roles as well. So how to go about doing this and how to make your mark early in your career. So the most important aspect from my side would be finding the right mentor. A lot of us are lucky enough to find the mentors in your own institute, but those who do not find them, they should seek mentorship from like the wonderful leaders that we have here, Dr. Hunavar, Dr. Namrata Sharma, and all the Ava ma'am and everybody else, you can reach out to them. And this is what we realized while we were working with the Young Ophthalmologist Society. The support from our national leaders like Dr. Namrata ma'am and Dr. Santosh sir was tremendous. And this really helped us in building the society and bringing it to the position, because without their support, it wouldn't have been anything. So your senior support is very important for this. Then landing up in the right institute. So my institute really helped me. So if you are in your residency and you feel that you're not in a very not so good an institute, you should aim for the best possible institute for your fellowship. Or if you are in your fellowship, you should try to get your first job in a really good institute, because it's a gold mine of data, mentors, patient exposure, the latest technology, and it will really change your life the way it did mine. The third most important thing is your friends. So you should surround yourself with great friends, positive people, like-minded, who will push you into doing some great things. Then it's really important to say yes to opportunities. So don't hesitate to say yes. As Dr. Maziba had pointed out, take opportunities, don't let them go. Be the yes man, say yes to everything possible. The question that comes to our mind is, what if you fail? Of course you will. You will fail so many times, but then you pick up your things and you move on. So that's really important. So until unless you don't participate, you don't win. So it's really important to participate and say yes to opportunities. Probably the 10 awards or 20 awards that I've won, for these awards, I had to present or appear in 100 examinations or 100 forums. So it's the success percentage might be just 10 or 15%, or maybe 1%, one award, but that award makes all the difference. So it's really important to participate on that aspect. And then don't ever let anyone tell you that you can't do something, even if that someone is you. So believe in yourself, go out and achieve things. And once you learn to say no, learn to say yes, it's really important to learn the art of saying no. Politely, yes, but because when your plates are full and you're taking in a lot of things, then you're not being able to do justice to all of them. So prioritize your work, like Dr. Shara, Dr. Abdul, Dr. Bipul, Dr. Arif, they've all had some beautiful publications. So they've prioritized their work. Dr. Maziba focused on a clinical acumen and honed those skills. So it's really important to prioritize things in your life. And for this, time management will greatly help you. This can be learned. You can learn it from people who are successful around you, or it can even be learned from some good reading and finding books on time management. So because not everyone can work well under pressure. So if you prioritize your things and have some time management, it will really help you. And the most important thing for our generation is to really embrace technology, because if we'll be left behind if we are not. So when this COVID pandemic happened, the biggest roadblock was all our meetings got cancelled. But eventually we realized that it was such a boon that we were able to connect with hundreds of young ophthalmologists through just a small Zoom meeting. So like we are doing today. So it's really important. And smart use of social media. A lot of people might look at it as a form of narcissism or anything, but I always think that it's really inspiring to see other people's success and learn from this and try to emulate that as well. And be aware. Awareness is really important about the conference that is happening, any award session or anything, so that you can participate properly in that. And another important thing is network. And in this age, it's really important to network at a global level. So all ophthalmologists are well connected, and you should seek them out and have collaborations, help each other. And if you want to collaborate with us, that's my email address and contact number. Look forward to your comments. Thank you so much.
Thank you, Dr. Devakan, for your excellent and excellent motivational speech. Thank you. We are really our residents and our youngsters are really motivated with your speech. Thank you. Congratulations. And I want to congratulate you. I think the Young Ophthalmological Society of India, now the member of World Ophthalmic Congress, or I think you have some good news. You can.
Right. So recently we got affiliated to the International Council of Ophthalmology. So we believe that that's the first young ophthalmologist society that has got registered, and we really look forward to our participation and creating a platform for young ophthalmologists on a global scale.
Thank you. Congratulations. Um, so, Dr. Unia, are you there? Dr. Unia? Hello, Dr.
Yes,
Unia?
yes, yes.
Yes. Do you have comment on Dr. Divakant presentation?
No, I think this is already excellent. Yeah, congratulations. I think your motivation and inspiration for the young ophthalmologists, all the doctor, the young ophthalmologists should be have like yours grant, yeah, in the upwards, up APO, and then for the leadership, I think it's very important. And making the networking, I agree with you. Yeah, making the networking from another colleagues, not only in our country but another country, like in the leadership program of APAO. I think it's very important for us. Yeah, making the good networking. I think. Sharing as a doctor, we're not in a clinician only, but publication is important also. Yes, I agree. Sometimes the researcher addiction, yeah, for us. When one time we have a publication and then we would like to make it more and more. But I think in here, I just want to remind sometimes if we already have a publication, a paper published, sometimes there are so many email come to our email and then from another journal, but we should be careful and then should be checked correctly. But because some of the email, even they are not a predictor journal, but they are fraud, but should be careful and then go to the web like a schema, go and then check it
Yes.
the correctly journal. I think it's very important for us, yeah, because sometimes we are so happy we are already had a publication and then we don't care about the predictor journal or fraud email for the publication journal. I think that's all.
Thank you. I think you have talked a very important issue about the ethical journal. And we are receiving some different journal groups that you have one publication has been done. Your such publication has been accepted, and we sometimes we are very much happy to see that. So we have to be more careful about that. So I'm requesting Dr. Victor Ko to present his presentation. Dr. Victor.
Thank you, Norman. Thank you so much for this kind invitation. I would like to spend maybe the next 3 minutes or 4 minutes to share a bit more about my journey. My name is Victor. I am a consultant ophthalmologist in Singapore, where I work at the National University Hospital. I specialize in glaucoma, both adult and childhood glaucoma, and I do complex cataract surgeries as well. Some of you may know some of my colleagues that work in the same institution as me, Dr. Ganga Sundar, Professor Paul Chu, Professor Caroline Chi. And Professor Lingam Gopal is also my colleague now at NUH. I have an academic position as well at the university, and I'm currently the lead in the Summit Program in Innovation at NUS. This is where my campus are. That's the bottom left-hand side is the old campus where most of the inpatient wards are. And in this bottom right-hand corner is our new medical center, 20-story high, and the eye center is right here at the 17th floor, where the patients can, on a clear blue sky, can have a good view of the Singapore Harbour. I see myself as a clinician innovator, and that's why I was very excited when I hear about the portable fundus camera project. But I am myself quite focused in the past 4 to 5 years in developing what I call a 360-degree ophthalmology in the community. You could see here a series and a suite of diagnostic devices that has been developed by my group with patents filed at NUS. The main aim ultimately really is, my dream is to have specialist eye care right in the community so that the patients can no longer have to come to the hospital. you can see COVID, there are so many bad things about it, but really COVID has driven this project to all the way from rank 100 to all the way to rank, top 10 in my university's view on this, because you now require such enablers to allow our patients to be seen in the community and being monitored there, rather than not coming to the hospital. I thought that, by invitation by Dr. Norman, I would like to share some posts that I have used to solve a lot of the challenges that I face as a young clinician innovator. I think Dr. Diva, I swear I have not copied, I've not spoken to him before, I've not shared any of my slides before with him, I've not seen his slide before, but most of the slides are about the same. You could see that I think the point number one is that you need to find yourself good mentor. I think he mentioned this as well. I am very lucky. I have good mentors where I work. In bottom left-hand corner is Professor Chu, who has been really influential in my career as a clinician innovator. He himself is a serial inventor, and I learned a lot from him. One of those things that he mentioned that really leave a very deep impression to me is this. One day he was speaking to me in a clinic during a busy glaucoma clinic, and he told me this: Vic, in the past, the clinician have to maneuver and change to overcome the limitations of our tools. But in this day and age, the tools that we have must overcome the limitation of the clinician. And that really set the tone, in allowing us to look at how we can change our medical devices to benefit us and our patients. Professor Ang Tin, you may know him, world-class researcher who clearly shows that you can be both good with your hands as well as good with your brains, and I owe a lot to him. I published my first paper in 2010 with him, as I mentioned earlier on. And last year, I spent time with Professor Peng Kor in Morpheus, where I subspecialized in pediatric glaucoma. And he, of all people, tell me that if anything, as a doctor, you could give hope to the patient. And I hope that, as we move research into the next era, we will be able to provide patients with hope with our research. The second thing that really helps me to overcome a lot of these challenges as a young researcher is to have a good team. I think Dr. Diva mentioned this before. You surround yourself with good friends. Similar concept, you surround yourself with a good team of multidisciplinary people with different skill sets. So I work with a dedicated team, a rather huge team that I've built from scratch, a good team of engineers. I now have in-house engineers that work with me to develop these medical devices that I mentioned earlier on, programmers, trial coordinators, like-minded clinicians, as well as commercialization experts that are good with developing business model and IP management. That is something that is very important in this particular field. And the last four really, again, very similar to what Dr. Diva mentioned. We have to be alert to opportunities. Opportunities don't knock twice. Sometimes they come, you don't grab it, you're not ready, you fall asleep, and they are gone. And you could see this particular paper that we published recently in ophthalmology really come out of the blue. I was looking at how the world has installed shields, on the slit lamps, but really there's no clear-cut evidence whether this is useful or not, and whether the patient wearing the mask or the ophthalmologist wearing the mask is much more important. And we ran a short 1-week study using mannequins and high-speed video cameras. And we are able to show that actually really the shield helps to block out large droplets, but really the patient wearing the mask is the key in preventing transmission of infection. This paper is, the research was done within a week. It was submitted and was accepted within 2 weeks. And so from beginning to the end, it's about 3 weeks. That's the opportunity that I hope all of us will be on the lookout for. And if it's there, grab it with both hands and run away with it. With that in mind, thank you for your time. Thank you, Dr. Norman, especially because I think this is the second time I see you in a week.
Yes, yes.
and I think going back to what Dr. Diva mentioned earlier on as well, opportunities and networking is so important in this day and age. I think we should make friends and make lots of network so that we can help proliferate our research and work with each other. Thank you very much.
Thank you. Thank you, Dr. Victor. So I'm requesting Professor Abha Madam to tell something about Dr. Victor's presentation. And Dr. Victor is very good researcher in the Singapore, ophthalmic researcher, and he got a lot of awards and lot of awards for his research. And he's also very
Yes.
active member of the Asia Pacific Ocular Trauma Society. He's a good
Yeah, I
presenter.
know.
Madam, please.
Right. Thank you, Dr. Victor and Dr. Divakan. Both motivational speech was excellent. And Dr. Victor has shown the mentors to whom he worked and the way he has served the humanity. That is very excellent. And his speech was very much beneficial for the participant, for the young ophthalmologist, for the resident to go forward and do their work accordingly to Divakant and Dr. Victor. So they are the youngster and they are the, I would like to ask one question to Dr. Diba and also Dr. Victor, how long this young ophthalmologist society will continue? Divakant will be the member of the Young Ophthalmologist Society, and also Dr. Victor, how long you will be continuing your young ophthalmologist?
So we have a criteria in India with our society that up till 40 years of age, we can continue as young ophthalmologists. So another 5 years for me. Yeah.
Okay. And Dr. Victor, in Singapore, what will happen?
We have similar criteria. I'm in charge of the education arm of the YO in Singapore. 40 years old as well as the cutoff, and 4 more years for me, I guess.
Okay. So it's a very nice motivational speech. Both are excellent doing, and it is very much helpful for all the youngster and all the young generation. Thank you.
Ma'am, Assalamualaikum. Good morning. Good evening. Good evening.
Has come back.
Yes.
Yes.
I
Right.
came back from another webinar. Welcome to everyone. And I hope everything is going smoothly.
Yes.
And it should be continued. Thank you.
Right.
Noman, unmute yourself. Noman, unmute.
Yes. I'm requesting our speakers, do you have any questions to our honorable panelists? Because in the different panels and different discussion, we have a lot of questions and you want to upgrade yourself. And we have Santosh Shinova here, we have Namrata ma'am here, we have Ali Pradhan here, we have Diva here, Victor here. So yeah, you can ask questions to them. And any questions? And do you want to know anything from them?
No question?
Sir, I have one question to Dr. Victor as well as Dr. Divakan. So in our country, we do have also a group that is known as the Young Ophthalmologist of Bangladesh. So is there any way that we can connect ourselves to the Young Ophthalmologist group of yours so that we can do something together?
Why not you create your own Young Ophthalmology Society of Bangladesh and then
Madam,
collaborate
we do
with them?
have actually our group, but I just want to connect with themselves.
Yes,
Oh,
of
yes.
course you can
Okay.
connect. You can collaborate. You can do collaboratively any work, any research, any webinar. You can do, of course.
Yes, and I want to share, there is a group for the young ophthalmologists in Bangladesh. This is a Facebook group. This is just a virtual Facebook group, and they have a very good communication with each other, and they have some academic exchange program there. But I think Madam is telling that you must have a group, a structured group, and you have to collaborate with the young ophthalmologist group from the India and also different part of the, and even you can apply for the ICO membership and a lot of things you can do. And you can take guide from the Divakan Mishra. And I think Dr. Diva, I am requesting you to guide our young ophthalmologists to do such work. Yes, yes. Thank you, Dr. Sarah. Dr. Mahajiba, you have some questions.
Yes.
Just one thing. In APU also there is a standing committee of young ophthalmologists. So every year APU also celebrate this Young Ophthalmology Society, Young Ophthalmology Group in very nice way. you can join at that. I may invite you to join in the APO session also.
Madam,
Yes.
that is, we should also incorporate with the, we have to consult with the OSB also, because OSB
Yes.
is there. OSB is the main group. We will we will be part of this group, and we should.
OSB is the member of APO. And very strong member
group.
and very vital member. So
We should go to you and
Yes.
Dr. Professor Sharfuddin sir to about our
Yes.
young ophthalmologist. Then we
Today,
structure,
I think today my young ophthalmologists are here. You got the scope of producing yourself in the international webinar. And Ophthalmological Society of Bangladesh is always with you. And in future, if you want to make a group with in OSB, it will be appreciated. And in future, you will be the another group in APAO, even in SARC Academy of Ophthalmology. In this way, I hope you will be able to be incorporated nationally and internationally. And you people who are today here, you will be in such situation that you will focus yourself by your activities, by your research, by your discovery. In this way, you will focus yourself internationally. Isn't it? Thank you.
Sir.
Yes.
Majiba.
Dr. Majiba.
Thank you. I just want to say, because we have the heads of ophthalmology with us today. We have Professor Ava Hussain Madam, we have Professor Sharfuddin sir with us. So with your guidance, if you give us the permission, we can actually formally make a request to Ophthalmology Society of Bangladesh to form a young ophthalmology society.
Yes, you start, and where necessary, we will give you advice.
Thank you.
You continue to start.
Thank you. Thank you. Any questions?
Thank you, sir.
Dr. Muhammad.
So I was just asking that this is an open question to all speakers. How important do you think it is to get formal training in research methodology, or if it should be on the job? Like, did you get separately trained, for example, an MSc in clinical trials or something like that? Or you should learn it on the job as you do? What's your opinion on that?
In our country, I will give some comment, and then I hope Professor Abha Hussain and others will give you, and Santosh Hanubar will also give some input. In our country, Bangladesh Medical Research Council and Center for Medical Education, there are two institutes. They are giving the formal training in research methodology, how to write a scientific paper, how to write a thesis, how to guide a thesis. In this way, they are giving the formal training. And also on job and in the institutional, training is also going on by their guidance, by the professors who guide the young ophthalmologists and even the students and residents who are now in FCPS or MS students, and they have thesis and dissertation. They are also guided by our senior teachers. And in this way, they are getting their training. But one thing is that formal in Ophthalmological Society of Bangladesh, only when there is a conference, they are presenting themselves and they are focusing themselves. In this way, they are proving them that they have learned, and during their presentation, if any problem or anything to be added, that is also guided by our seniors. In this way, they are being trained up. Anything to add?
Yes. College of Physicians and Surgeons also, that is the offering the FCPS. That college regularly doing the workshop where the fellows and also the ophthalmologists can participate and share their, exchange their knowledge and participate in the workshop, a full day workshop for this research methodology. So that is another way. And in addition, Professor Sharfuddin has told nicely the other thing, and I am just including the College of Physicians and Surgeons activity. They are doing this type of workshop for the dissertation, for the thesis, and for the general research orientation program.
Thank you, Professor Abha, Madam.
What about in India? Can we hear from Santosh Hanubar?
Yes.
Right. We have formal and informal training programs. Formal training programs are run by institutes themselves. In fact, some of the institutes, major institutes, have residency training. It's a part of the curriculum during residency training before a thesis topic is allotted or even submitted. Otherwise, we have online courses which most people take. It's important to get trained because that will shorten your learning curve. Otherwise, on-job training is fine, but then you'll make many mistakes before you become perfect. If you want
Yes.
to shorten the learning curve and hit the ground running, then I think it is good to take courses on research methodology and also basic statistics. Both are important. Manuscript writing can be learned, although there are courses on medical editing and manuscript writing. Those may not be essential if your English language skills are good. That will come, but statistics I think is very important, and also the way you plan your studies and interpret.
Okay.
Okay, Professor Namrata, are you there?
I think she's dropped out.
Oh, yes. Ellie?
Okay.
Ellie is present or not?
Okay, she was present. Yes,
Yes.
Dr. Eli. Yes.
Yes.
Dr. Eli, actually, we was discussing about the research methodology or research training. So what about, do you have any structured research training in the Nepal?
Yeah. Yeah, we do have residency training as well as fellowship training. So, it is a kind of mandatory, a part of academic, when they are enrolled in first year, so they go for research training and all. So that will brush up their ability. So because they need to have a thesis or dissertation submitted at the end of their residency program. So they do have about 6 months training in the beginning. So I would recommend, as Dr. Mohammed was asking, whether it's mandatory. I think it is necessary, even for those trainees or even for us. Sometimes we also need. So I think it is recommended, research methodology, even biostatistics. If you get some ideas and all, we do need to collaborate with them, but then it will be good. Yeah.
Okay, you are telling about the what starts in first year. Your courses are for 3 years or 5 years? Resident course?
Yeah, we do
3
have.
years.
No, we have 3 years training, residency, masters.
Okay,
So in the
3
first year, in the first 6 months, they go for research training.
Okay.
We have designated institute for training and training purpose.
Okay, this is the research training for first 6 months.
So is it Master of Surgery? Is it MD or MS course?
Both.
Sorry, Dr. Ali, is it MD or MS course in ophthalmology?
We have, because we have different institutes. Ours is MD, and other institutes, they have MS. But meaning by it's the same.
Same, masters.
It's masters. Masters, yes.
So I have one question to Dr. Santosh. You have two courses in the India, DNB and also Masters of Surgery. So what is the difference between the DNB and Master of Surgery?
MS is generally run by hospitals and institutes that are affiliated to universities, either general universities or medical universities. Where DNB is, where private hospitals which have a teaching capacity and training capacity, they are organized into a separate category where they offer not MS but Diplomat of the National Board, which is a centrally run examination. Whereas MD and MS exams are run by the university or the institutes with their own internal examiners. DNB is absolutely objective because it's run by all external examiners. So it's more.
And these two degrees are same in your country?
Correct. They're equal for most of the purposes, but for job purposes, there is some discrimination, I believe, against DNB, especially in government institutes. So that's
government institute, DNB is not allowed, isn't it?
It's allowed, but there is some discrimination.
Yes.
Legally,
yes. And any MS student can get this degree from the private institute, and then he will be MS DNB.
No, if somebody has already done an MS, then they don't have to undergo training again. They can directly take the exam.
Okay, fine.
Okay.
Thank
Fine.
you.
Then
Dr.
they will get 2.
Yes.
Okay.
Yes.
Dr. Santosh, that means DNB, by doing DNB, he or she can only apply to the private institute.
No, they can apply anywhere. They are equal in terms of everything else. They have equal fellowship opportunities. They have equal job opportunities, but they have to do senior residency for so many years. It's a fixed number of years before they qualify for a faculty post in a government institute.
Okay.
They have, I think, 1 year more of senior residency requirement than MS candidates.
Yeah.
If they want to join government institutes.
But there is no such fellowship for long continued fellowship in your country as like us, as like FRCS, like that fellowship for.
We don't have a national fellowship. We have AIOS fellowship, which is just examination based, which is called FAICO, and it is merged now with ICO also. In fact, there is a
Yes, I know that.
Right. So that is one way of doing it, but that doesn't involve any formal training. It is just an exam that you take irrespective of what training background you have or experience you have. That's what we have. And most of the government institutes don't offer fellowship. They offer senior residency, which is equivalent to fellowship. Whereas most of the private organizations offer fellowship, which ranges from 1 year to 3 years. At the end of it, you can take a qualifying examination, which is AIOS based, but some universities such as Rajiv Gandhi Health University in Karnataka offers a university recognized fellowship program. And in some institutes like PGI, MCH has started in ophthalmology, MCH in vitreoretinal surgery, and there is DNP in vitreoretinal surgery as well. So vitreoretinal surgery has gone to super specialty level.
Right. But in your country, ICO exam is also going on.
Very common, very common. Most of the
Very common, like us also, yes.
Yes.
Thank
And
you.
what are the benefit? ICO exam part 1, part 2, and part 3, all.
Well, everybody wants to take all the 3 parts because then they get MRCO as well, and then they get
Yes,
exemption
right.
if they have any
That is the prerequisite for MRCO.
You automatically get it once you take third part.
Part 1, part 2, part 3.
Yes.
Okay. Noman?
Yeah, thank you. We are almost at the end of the session. Our target is total 2-hour session. We have 10 minutes more.
Okay.
And now I'm requesting Professor Abha Madam, our guest of honor, to tell something about our innovative surgeons, our youngsters, our guests, and I'm requesting you to tell something.
Okay, thank you so much. As because whole evening we are very much interactive session, and I would like to congratulate our speaker, that is Dr. Badhon, Dr. Malik, Dr. Shara, Dr. Majiba, Dr. Bipul, Dr. Arif Pathan.
Thank you,
for their excellent, everybody admit, all the panelists, all the special guests, and all of you that this is right, that their presentation is excellent. And I am so proud. This is the first time I have attended so many webinars, but this type of webinar is the first time that young generation are having their appropriate, what I say, that appropriate honor, appropriate, I think they should achieve it. They achieve this and they have made their goal, so that Dr. Noman from the Research Ophthalmic Forum, Professor Sharfuddin is the president, and Noman is the main person who is organizing. So they have given this honor to them, and this is very much, they deserve it. They deserve it. So I think I should congratulate them once again and repeatedly for their innovative device, for their journey to their own research, their journey to up to British Journal of Ophthalmology. That is, of course, a very interesting what Bipul has said, that repeatedly several times it has coming back, and he has again submitted and again come back, again submitted, and in this way ultimately accepted. Not that he said that till now it was not accepted, that has accepted. So it is a very good thing. And the Devikant and Victor has given a very motivational speech, and all the things are in so nice way. I have seen Dr. Devikant in the leadership development program. ICO launched that leadership development program. Dr. Santosh was also present in that, and they have a forum. All the leadership development graduate, they have arranged the session, and that was an excellent session. So from there, I know Dr. Devikant, and today I have seen that all the top leader of APO, that is Danny Islam, Clement Tham, and also ICO leader Bruce Pivey with Devikant. So I can understand where is Devikant now, and with Santosh, with Professor Namrata Sharma, all are in a same frame. So it is very nice. I think I was not with them, but I mentally with them, and it is very much appreciated that our young generation are coming up, and they are doing so nice thing, and we will learn from them. As because the British Journal of Ophthalmology, I will say a few things. In 1985, I was working in Princess Alexandra Pavilion. There at that time, I am working with Dr. Kalin, and he has worked also in the neurosurgery, neuro-ophthalmology part. And when I was with him at that time, empty cellular syndrome, 2 cases, only empty cellular syndrome he found, and he gave me that you please do, you present this thing in your ophthalmological conference, and then you published in your own journal. If I try to publish it in British journal, it will take long time, and ultimately it will not be possible, as because this is only 2 cases. So go back to home and then publish. And I did it, and I presented in my Ophthalmology Society conference in 1986. And at that time, Professor Roshuddin is one of the very famous neurosurgeon. He was sitting in that session. I was thinking how it come. All the ophthalmologists and only one best neurosurgeon was sitting in the first row. And after finishing my topics, he called me, and he said that I am only because of you come here, that how is it possible that ophthalmologist touches our area? We know that ophthalmology will only inoculate the eye, and this thing, and only von Graffi incision, they are doing the cataract surgery. That was their time, only that thing, that way the cataract surgery was done. So that was the history. So nowadays, my boy, my girl, they are coming up in so deliberately that Badon has innovated the device. You have seen what thing he has vetted, and this was so handy and so nice that if we can see the retina, vitreoretina surgeon, and all the ophthalmologists will be benefited by this device. So congratulate again. And Dr. Malik, also congratulations. Dr. Shara Rahman, so nicely delivered. I again thank you, and it is a very good thing that everybody will learn from you. And Dr. Mahajiba Rahman, she's really asset, as because she's the daughter of one of our friend, my student, of course, her father, Professor Dr. Mahbubur Rahman Chaudhuri, and she is the duplicate of her father, not duplicate, I will say that much more better. Yes, Professor Sharfuddin also agree with me. Is much
because Mahbub is my friend, that's why I can say she is better than.
So it is very nice thing. Congratulations, Mahajiba. Dr. Bipul Kumar, I have told that he did very nice thing and he will go forward again. And Arif Pathan, that is my very feelings. Just few days back, I sent one summary of my patient to Dr. Santosh, and he has advised that brachytherapy, for brachytherapy. And today I am saying that you are doing that also. So it is very nice. Thank you very much, Arif. And Arif is doing very good and all the way. So Dr. Santosh is with you. He will always help, and everybody is helpful to each other. So I think Dr. Inia is here, and Dr. Eli, one of my beloved student all over the world, my student. I feel so proud that she is in the quarantine period, but she is still attending this webinar. How energetic and how lovely person. So I'm really thankful to Dr. Noman to arrange this sort of webinar, and please continue this thing so that our young generation will come up. And I'm inviting all of you to the APO 2021. I don't know whether it will be happen that we can do the physical, but it has already said that August 1st to 5th August to 2021, there will be the Congress of APO. Till now it is fixed. So this might be hybrid, this might be only physical, or time will say what will happen. So I am inviting all of you, and that time I will take the charge of president of APO with your all blessings, and with you all, my hand will be very strong. And thank you so much for this evening, and inviting me, Professor Sharfuddin and Dr. Noman, for inviting me to attend this session, lovely session. Thank you all.
Thank you, Professor Abha, Madam. You are always our motherly, your attitude are always motherly. You are very much encouraging to everybody. So we are really proud of you, and advance congratulations to become the APO president. Thank you, Madam. I am requesting, we are at the end of the session. I am requesting our host, come chairman of this session, Professor Sharfuddin Ahmed, sir, to end the session and tell something.
Okay. Thank you, Noman. Thanks to Bangladesh Ophthalmic Research Forum and also Ophthalmological Society of Bangladesh, as because we have arranged just a program here that the young ophthalmologists, they cannot say that we are ignored. From here, Santosh Anubar is here. You can also give your paper to British Medical Journal, British Journal of Ophthalmology, Indian Journal of Ophthalmology, and also in OSB. You are also giving in our journals. This webinar, here you are getting the Indian Namrata Sharma, Santosh Anubar, Eli Pradhan from Nepal, also from Indonesia, Irabati is here, and also other international Victor is here. They will help us, we hope so. So young ophthalmologists, you are to discover, but discover is not a very easy thing. You are to increase your knowledge by moving yourself systematically, analytically. So research is not a simple thing. You are in the dark. You are to come out from this darkness to light. Don't forget that the night will be always with you. The day will remove this darkness after finishing the night. So research work, I hope it will increase your knowledge, as well as this will give some of the preventive measures to maintain the, to prevent the blind people to survive in this country. And not only in Bangladesh, also in the globe. So we have already crossed the bar. You people will take our places. I hope the presentation, I will not take the name of anyone, as because Madam has told everything. I will not take much more time. She was with you in the presentation. This was the first number 1 episode. Number 2 episode, at that time, we can also invite all of these seniors for the young ophthalmologist, how to write a scientific paper, how to write the thesis, how to guide the thesis. And also, we can also include the research methodology. In this way, the seniors will come and juniors will present what they have mistaken, that will be corrected by our seniors. In this way, research work, which is not interested to everyone. Someone is disinterested to research work. But I hope you people, along with other young ophthalmologists, will come up, and in future, we will make everything bright. And lastly, I will say, unexpected results and the problems of the research work, that will be the part of your life. These problems and solutions will be made by research work. And again, I will say, the never lose hope in any condition. And because darkness of night always will end at the light of the day. So I hope everything will be all right in future. You all will be with us, and the seniors who has given a lot of time, like Santosh Hanovar, like Professor Abha Hussain, Professor Namrata Sharma, Eli Pradhan, and Victor from outside, other than Bangladesh. I hope this type of webinar will give us much more opportunities to learn, and learn. I hope I will thank one person, Shams Muhammad Noman, who is the organizer of this in support to Bangladesh Ophthalmic Research Forum. He will again arrange, and he will communicate with our experts of national and international level. He will cooperate with us, and hope everyone will be happy and healthy in future. Oh, Professor Namrata Sharma, I was asking, she is with us, and
No,
I
it's
was just,
okay.
Yeah.
yes, and she was with us, and she will also be helpful in future for the research work in the young ophthalmologist. Thanks to Santosh Hanovar, Namrata Sharma, Eli Pradhan, Irabati, Victor, and lastly, and firstly, Professor Abha Hussain, President-elect Asia Pacific Academy of Ophthalmology, who is the motherly guardian of all of ours of Bangladesh, and also now in the Asia Pacific region. I will not take much more time. Thank you very much for giving your valuable time with us. In future, again, when we will request, I hope you will come with in the next webinar. Thank you very much. Thanks again.
We are
Thank you,
very
everybody.
grateful. One thing, we are very grateful to Professor Namrata Sharma, who is
Yes.
always with us, and Dr. Santosh also. But
Yes.
Namrata is very much linked, often come to Bangladesh, and in the webinar, always in all the webinar of Bangladesh, who might be the organizer. Namrata is present. So thank you, Namrata. Thank you, Dr. Santosh. Thank you all. Thank you all.
Thank you, Aristovision, for supporting
Yes.
our, supporting
Yes,
our this
Aristovision, we have
webinar.
to give thanks to Aristovision also.
Yes.
Thanks to Aristovision. Okay, Noman, you can conclude the webinar.
Okay,
Now we
thanks everybody. We can just at the end of the webinar, and we have finished on time. Thank you and congratulations, everybody. Thank you, everybody.
Okay.
Thank you.
Thank you.
Thank you.
Thank you. Thank you all.
Thank you, Diva. Thank you, Inia.
Thank you.
Irabati. Yes.
Thank
Diva.
you. Thank you.
Yes.
Hello, Victor. We'll see you again.
Okay, madam.
Sarfuddin,
Yes, madam.
ডক্টর শফিকের ওয়াইফ মারা গেছে
জি, ম্যাডাম, আজকে সকালবেলা 7:30
সকালবেলা
due to
আমি
corona.
একটু আগে
Corona. And she
শেষ
had a long dialysis.
Yes.
Chronic kidney disease, CKD, and dialysis. And one of our colleague, Professor of Ophthalmology, Professor Shafiqul Islam, his wife passed today in the morning, passed away due to corona.
That's really
Corona
sad.
with
Really.
I think she is with a chronic